HMRAlert is a small software widget that has been installed on your computer to alert you to patients that may benefit from a home medication review. The alert criteria is set by you and can be configured independently of other practitioners in the clinic. When a patient's record is opened in best practice that meets the HMR criteria, an alert is displayed at the bottom of your screen. The trigger behind the alert is detailed. In this case, Mr. Armstrong has had a hospital discharge within the last 30 days. If an HMR referral is issued for Mr. Armstrong, the alert will not fire again for another 12 months. To set or adjust the alert criteria, double-click on the bell icon in your computer system tray. The system tray is a cluster of icons at the bottom of your screen. You can set criteria based on the patient demographics, medical history, and/or prescribed medication. Let's begin by examining the options on the first screen. Patient age is self-explanatory. In this example, an alert will be fired for all patients greater than 80 years old. The Aboriginal or Torres Strait Islander option fires when the ATSI setting is set in the best practice patient demographic screen. The recent hospital discharge alert is activated if a discharge summary has been recorded within the set period. HMRAlert looks at the best practice correspondence in list for an entry with a discharge summary category. The number of prescription medicine count is based on the number of current scripts in best practice. An alert will fire for any best practice patient record which meets any one of these criteria. Not all of the criteria need to be met to initiate an HMR alert. Alerts based on medical history are a little more complex. To add a medical condition trigger, type the condition in the text box and double-click on the required item in the resulting list. HMRAlert searches the same medical list used by best practice. You can add multiple items. An alert will be displayed if a patient exhibits any one of the entered disease states. To remove a medical condition from the list, just double-click on it. Best practice uses a coding system called DOCL to group related medical terms. HMRAlert works with the DOCL structure to determine which patient terms to fire on. To illustrate this point, click on asthma and then on the information button. Any patient that has at least one of these terms recorded in their medical history will initiate an HMR alert. Caution must be exercised when selecting medical history triggers. For example, if we select a trigger on heart block first degree, a patient with a recorded heart block condition will not fire an alert. If, however, we place a trigger on the more general heart block term, a trigger will be fired for patients with either heart block or heart block first degree, as well as any other term in the list. Like medical history, the GP can set triggers on one or more drug or drug class. Search for a drug by typing in the text box and double-click on the desired item in the resulting list. As before, double-click on a drug to remove it from the list. An alert will be fired for any patient that has been prescribed a drug that falls within any of the trigger ATC classes. When your alert configuration has been set, press on the Close button to hide HMRAlert. Even though the widget is no longer visible, it is busy scanning your patients against the HMR criteria you have set. If you feel that you are getting too many or too few alerts, you can change the settings at any time by double-clicking on the bell icon in the system tray. That concludes the HMRAlert configuration video. The next clip illustrates how to generate the HMR referral after an alert is fired, and how to send it electronically to the pharmacy for review. Before we leave, however, it is critical to point out that HMRAlert is an assistive tool only and should not be used as an HMR decision tool. It is possible for an alert not to be fired as expected due to the unfamiliarity with the coding systems used for either medical terms and/or drug classification. It is also possible that an alert is not triggered for a patient who would greatly benefit from a home medication review. As always, use professional judgment. Please direct any queries to your practice manager, who will forward them on to the Medscope support team. Thank you for your time.